memory consolidation and reconsolidation. Memory consolidation is the process wherein an experience that you're having becomes a memory. So the important thing to understand about this process is just that it's a protein thing that's happening in the brain. And that helps stabilize the long-term potentiation pattern, which is just a fancy way of saying that a pattern is going to refire in a very similar way over and over and over again. And consolidation is this process, it's a natural process in the brain that helps that firing pattern become more stable. So memory consolidation is the word that neuroscientists gave to this protein process. Memory reconsolidation is an updating thing. So again, there's going to be a protein process, but what happens is that the original long-term potentiation pattern, that original firing network that always knew a thing, it's kind of organized into a meaning about the way the world works, about who you are. When the reconsolidation occurs, what happens is the network opens up and becomes what's called labile, fancy word for I am now updatable. I am now open to taking in new information. Until it becomes labile, it is untouchable. So if you've ever had a client who it felt like they were making big growth, like let's say you have somebody, self-worth is such a common issue, so let's use that. You have somebody who comes in and they just can't stand themselves. And they've been in therapy with you for a while, 6 months, a year, 2 years, even longer. And they're making great strides, making huge strides. There are lots of moments now when they do have positive experiences toward themselves or are practicing mindfulness or self-talk in this way that's giving them more space or a little bit more ease. And they're doing all of that good layer cake building, right? They're doing great. And the self-worth still hasn't budged much. It's almost like the two networks lay beside each other. And now this person has like this old road and this new road, but that new road isn't really changing the old road yet. That is a non-labile network. So it hasn't had the principles, these little elements in place. It hasn't had that happen yet in such a way that it's going to open up to take in new learning. It's still consolidated, right? So the reconsolidation process is just what neuroscientists named this thing that happens when an old network that was consolidated opens, takes in new learning, and then reconsolidates, but in a new pattern. And once that happens, it never fires the old way again, it only fires the new way. So something to grab here is that this is not a therapy word. Memory reconsolidation is the term neuroscientists have given to this natural phenomenon. A ways back, at this point 20 years ago, work had been consolidated. There was no changing it. That was true up until the late 90s, early 2000s, when a bunch of research started getting done about whether or not, is it possible to shift a consolidated memory network? So some of that's a tech thing. It was just that we didn't have a lot of ways of even conceptualizing or testing this idea prior to 1997. Now we hit 1997, 98, and all of a sudden there's lots and lots of new tech. It's getting better, and we're moving forward into an age where we can really look at a brain live, and that's starting to be applied to things like memory. So before then, it was thought, okay, memory consolidates, it knows a thing. Well, we can build a whole bunch of skills. We can build new pathways in the brain that are going to counter the old message or help us with that old message so we don't always believe the old message. Then, starting in that late 90s, early 2000s, all this research started getting done, first with crabs and then with other types of animals and eventually with humans, to wonder, is it actually possible to change a consolidated network? And it turns out it is. So this doesn't belong to any therapy. This is a name neuroscientists have given to the natural phenomenon of this updating process. So when you think about memory consolidation, think about a protein thing that helps us know a thing and kind of keep it locked in place, which is really handy for stuff like gravity and what is food and what is not food, and also how do relationships feel and how should I connect with people. It's really, really handy. Remember, the fact that we're walking on a psychological floor is actually a good thing, even though it may have hard bits in it. And then this memory reconsolidation, that's an updating thing. And again, that protein process does happen, just like it does in consolidation, but this time it's in a new pattern. The network comes together in a new way because it knows something different. Let me tell you how extreme this really is. I don't know if you've heard about this, but astronauts who go up to the space station are having a funny thing happen. They are coming back and dropping things all the time. So they go up and they spend 9 months or longer up there at the space station. And at the space station, if I just let this go, right? Here's my handy pen again. If I just let this go, it would float right next to me in space. And after having this happen over and over and over again for this many-month process, astronauts' brains reconsolidate to forget about gravity. And then when they come back to Earth, they are holding things and they let them go and then are shocked when they drop. And so it takes a few weeks of reconsolidation again, where their implicit mind relearns gravity. So when we're wondering about, oh wait, is this possible with any memory, any learning? No, really, any learning. Astronauts can forget that gravity is a thing. So that's an updating of the implicit memory system. In order for the reconsolidation process to occur, 3 elements are needed. The first element is that the network, that part of your psychological floor that knows the thing that we're going to maybe unlearn, must be up and active. So it has to be alive, embodied, knowing what's going to happen next. So your emotional knowing is what we're going to call it. That has a knowing about what's happened, what it meant to you, and also a prediction about what might happen next based on all that knowing. So we need that network running electricity in an embodied way. So that's part 1. 2, another learning that mismatches that prediction must also be up and alive in the body. And it has to be running enough electricity for there to be a prediction error because of that dual learning. And then what has to happen is that once that network gets surprised, which is what it is, it's a prediction error, so whoop, the network goes, wait a second, that's not what I thought would happen. And when that occurs, it's now labile or opened. And then what has to happen after that is the new learning has to be repeated. At least once, but probably more than once. For most networks, it needs at least once. And a lot of people I work with, it's really helpful to do it many times while the network's open. And if it's repeated after the labile state, memory reconsolidation will occur and it will be permanent. I find that the neuroscience-y words and even some of the words like schema and prediction error, stuff like that, it feels hard to remember. It feels hard for me to hold it in the room. And so for our course, we are going to translate this into a different vocabulary. So I want you to learn the vocabulary with me so you know what I'm talking about. The original prediction, we're going to call an emotional knowing. The reason I like to call it this is because it names it in a way that feels more right in my body. Like, it's kind of hard to wrap vocabulary around. I don't know that we even have the words in English to perfectly understand what it is I'm talking about, but when I say learning or knowing or thinking or understanding, we're thinking of it as a cognitive process, and it's really important that you understand none of this is held in the parts of your brain that are doing that cognitive processing. The implicit memory system is part of your subconscious mind. So what it knows is more like an embodied awareness, an emotional truth about how the world works. So in order to remember that, I'm saying, oh, it's an emotional knowing. So when I say, oh, do we know what the emotional knowing is? You understand what I'm looking for is that first element. Do we have that emotional knowing in our awareness? Do we have that prediction error in our awareness, that prediction possibility in our awareness? So there's that first element. The original network is up and active. The emotional knowing is alive. Second thing, in this research, most of the time, you'll see the word juxtaposition. What they are meaning is that the new knowing and the old knowing are compared in that moment. There is a juxtaposition or a mismatch. What we're going to call that is the mismatched knowing. So the second knowing that we're going to use as our juxtaposition, we're going to call the mismatched knowing. So that's the new discovery. And when I say new discovery, it doesn't actually have to be a new experience. In fact, most of the time, the mismatched knowing is already known, but the brain doesn't realize that it's known. And then a third element I'm going to be talking about a lot is this thing they talk about in the research, that the prediction error, mismatch detectors must be online. And there's certain elements that need to be in place for that, and we're going to call that brain in healing state. So when I say healing state, all I mean is that network's up and active, but we have not lost our mismatch detection capability. Ooh, that one's a hard one to say. Mismatch detection capability. When we have not lost that and we're activated in an embodied way with the old knowing, we've hit healing state. And just to give you a little preview, we'll get deep into this later on, but it can be very difficult to hold healing state, especially if the prediction is something like, everyone will abandon me, or I'll always be rejected, or I'm about to die. So when I have that kind of knowing up and active in the body, it actually takes quite a lot of work, quite a lot of art and skill to help a client hold a healing state while that kind of knowing is up and active. So those are our three pieces of vocabulary I really want you to take home: emotional knowing, mismatched knowing, and healing state. The next thing I want you to know is that a ton of therapies are already doing this. Some of them know it, and some of them don't. But if you're hearing this and going, wait a second, aren't those elements part of EMDR? Aren't those elements present when I'm doing parts work in IFS? Yes, they are. If you're already trained in something like somatic experiencing, brain spotting, IFS, you may or may not have been trained by someone who's talking about this neuroscience. But when I look at those, I absolutely look at them and say, you know what? They're doing memory reconsolidation, and they may or may not know it. I think about Les Greenberg and emotionally focused therapy. He's out of Canada. He used to work with Sue Johnson a long time ago, and then they created two different things. So when I look at Les Greenberg's model, I say, oh my gosh, he's setting up these mismatched knowings all over the place. He's making sure we're slowing down and tracking the network enough to bring it up into the body, but not so much the way we're orienting to it is holding the brain in healing state, but I've never heard him talk about memory reconsolidation. And it may be that he's unaware of this kind of science. So if you already have some training in your back pocket that looks like, ooh, I think maybe I'm already doing this a little bit, chances are good you're right. And in this course, I want to make sure that the principles of how this work sit really deeply in your psyche and even in your body, so that you can do the things you already do with even more nuance and more art, and maybe gain some new skills that will help you make the stuff you already do even deeper, and your relearning process is way more efficient. In the next session, we're going to look at how to help clients discover their personal emotional knowings.